In the next few minutes, we'll see how insulin resistance could be your greatest enemy, destroying your health, and how to prevent it. Let's begin with the basics. What exactly is insulin resistance? Insulin is a hormone that's produced by the pancreas and is responsible for transfer of glucose into your cells. Insulin resistance occurs when your body's cells don't respond to insulin, making it difficult for glucose to enter and provide energy. So the body reacts by producing more and more insulin. As a result, the insulin levels in the blood start getting high. Insulin also makes us hungry and is also a fat storage hormone, which means high insulin keeps us hungry all the time and also promotes weight gain. Insulin resistance has a risk of progressing into prediabetes and type 2 diabetes. Insulin resistance is when the cells become resistant to insulin. Prediabetes and diabetes occur when the pancreas don't make enough insulin to maintain normal blood glucose levels. Insulin resistance is also the single biggest factor for coronary artery diseases, responsible for 42% of heart attacks. Insulin resistance is also associated with several other conditions including obesity, non-alcoholic fatty liver diseases, metabolic syndrome, obstructive sleep apnea, polycystic ovarian syndrome, Cushing syndrome, lipodystrophic syndrome, hypothyroidism, stroke, and cancer. Insulin resistance is not just difficulty of transfer of sugar to the cells, but it's a complex situation with multiple implications. Let's see why insulin resistance occurs. Every time you take food, an insulin spike occurs in your blood. The intensity of spike depends on many factors like the carbohydrate content of the food and glycemic index, which is the speed at which the glucose levels increase after the consumption of food. More frequent and higher insulin spikes over a period of time lead to progressively less response from the cells to insulin, causing blood glucose levels to rise. It's as if the cells are developing some kind of immunity to insulin. This leads to production of more insulin to manage the blood glucose levels. If not intervened, this high insulin and blood sugar levels will have multiple unhealthy effects all over the body. So who's at risk? Well, anyone. It's more common above 45 years of age and where there is a family history of type 2 diabetes or in people leading a sedentary lifestyle. Overweight people, especially with excess fat around the abdomen, and those under steroids, antipsychotics, or HIV medication are under higher risk. Low vitamin D also contributes to insulin resistance. Smoking is seen to decrease insulin sensitivity and hence is a risk factor. How do you know if you have insulin resistance? What are the signs and symptoms? Usually there are no symptoms, but frequent hunger, even shortly after eating, persistent fatigue and low energy levels, tiredness and fogginess after a meal, unexplained weight gain, especially around the waistline, are all warning signs. Thinning of hair and having bald patches is another red flag. There are a few signs that your doctor will be looking for. Waistline above 40 inches in males and 35 inches in females. Acanthosis nigricans, which is a condition that causes areas of dark, thick, velvety skin around the neck, groin, armpits, and in body folds and creases. Skin tags or acrocordon. Blood pressure more than 130 by 80. Blood sugar more than 140 milligrams per deciliter. Fasting blood sugar more than 100 milligrams per deciliter. A1C 5.7 to 6.3%, also known as the hemoglobin A1C or hemoglobin A1C test, which is a simple blood test that measures your average blood sugar, levels over the past 3 months. Fasting glycerides above 150 milligrams per deciliter. HDL cholesterol less than 40 milligrams per deciliter in males and 50 milligrams per deciliter in females. Make sure that you consult a healthcare provider for a proper diagnosis and to discuss your results. The gold standard method for diagnosing insulin resistance, a hyperinsulinemic euglycemic metabolic clamp, involves multiple intravenous administration of insulin and glucose along with measuring blood parameters numerous times. This method is limited only to scientific purposes and is expensive and invasive. HOMO-IR Insulin Resistance Calculator, which stands for Homeostatic Model Assessment of Insulin Resistance, is more commonly used to calculate insulin resistance. It's a product of fasting glucose and fasting insulin divided by 405. Can you prevent or reverse insulin resistance? The good news is that insulin resistance, prediabetes, and even type 2 diabetes can be reversed if rightly intervened at an early stage. Regular physical activity is a powerful tool. Exercise helps improve insulin sensitivity. Any type of physical exercise like aerobics or resistance training have been found to be equally effective. A balanced diet rich in whole foods like fruits, vegetables, lean proteins, and healthy fats is essential. Avoid the following foods: sugary drinks such as soda, juices, and sports drinks, processed foods which often contains trans fats, white rice, bread, pasta, breakfast cereals with added sugar, yogurts with added sugar, honey and maple syrup, flavored sugary coffee drinks, and French fries. They have very little nutritive value and contains a lot of unhealthy refined carbs. Different fruits have different effect on spiking insulin. Fruits like bananas, mangoes, and grapes cause high insulin spikes. Apples, oranges, kiwi, and unsweetened coconut flakes cause lower spikes. Insulin spike also depend on how it is consumed, as juice or as whole, along with which food it is consumed, time of consumption, and quantity. We will discuss this in another video. Low starch vegetables like broccoli, asparagus, beets, carrots, cauliflower, green beans, leafy greens such as spinach, snap peas, mushrooms, Brussels sprouts, onions, pepper, and zucchini have low insulin spikes and should be consumed more. Non-starchy vegetables are rich in fiber, which is important for managing insulin resistance and diabetes. It helps keep you full and stabilizes blood sugar by slowing down digestion. Fiber also helps lower cholesterol levels. Healthy fats cause low insulin spikes. Monounsaturated fats and polyunsaturated fats are the healthiest. They reduce cholesterol and help stabilize blood sugar and insulin levels. High intake of saturated fats from processed foods become toxic, causing inflammation and oxidative stress in human adipose tissue, leading to impairment of mitochondrial function and insulin signaling, and consequently insulin resistance. Foods and oils with higher amount of monounsaturated fats include nuts, avocado, olive oil, peanut oil and butter, and sesame oil. Sunflower, sesame and pumpkin seeds, flax seeds, walnuts, fatty fish and salmon, tuna, mackerel and sardine, and fish oil, soybean and safflower oil contain polyunsaturated fat. Saturated fats, by comparison, are best consumed in moderation. Foods carrying large amount of saturated fat include fatty red meat, commercial pastries, and butter. Also, plant-based fats like coconut oil and palm oil contain large amounts of saturated fat. Coconut oil is 92% saturated fat and therefore raises cholesterol levels similar to animal fats like butter and lard. However, it contains a unique type of medium-chain saturated fat called lauric acid that research shows raises HDL or good cholesterol levels, which may lower overall heart disease risk. In addition, the oil delivers a favorable effect on glycemic control, possibly because of the lauric acid and phenolic compounds rich in anti-inflammatory effects. Consume low quantities of grains, even if it is whole grain, because most whole grains are highly processed and fiber benefits are ruined. So most whole grains are just carbohydrates. Animal foods are low carb, but lean meat should be preferred if cholesterol is concerned. Lean meats are meats with relatively low fat content. Skinless chicken and turkey and red meat such as pork chops with the fat trimmed off are examples of lean meat. Plant food should still look like the plant it came from and not packed or processed. Avoid anything with added sugar and, importantly, eat only when hungry. Don't eat anything you don't like or anything that doesn't feel good after eating. Also, don't have anything labeled as low fat, as low fat means high carbs. Try to include fermented foods like yogurt and kimchi and cottage cheese in your diet because it reduces the overall glycemic load of the food and also reduces blood pressure and insulin resistance. Fermented foods contain a lot of probiotics which play a very important role in keeping you healthy. Stress management techniques such as meditation or deep breathing can be helpful. Prioritize quality sleep to regulate hormones and support overall health. Sleep deprivation is a major hazard. Work with a healthcare provider to create a personalized plan tailored for your unique needs. Insulin resistance is definitely the enemy inside you, the terror within which could easily destroy your health and quality of life. But it's a battle you can win with lifestyle changes. If you found this video informative, please share it with others seeking to understand and combat insulin resistance. Thanks for watching.